Morena everyone, before I begin, I would like to give a big shout out to celebrate Te Wiki Te Reo Māori in Aotearoa, also known as New Zealand. Today marks the 4th day of Māori Language Week, and this very special event has been celebrated in New Zealand since 1975. I'm very grateful and fortunate to be able to experience this unique culture in New Zealand. Ke kaha te reo Māori. No mai, haere mai. Welcome to Centre of Balanced Life. I hope you don't mind me practicing my te reo Māori. My name is Kenny, the acupuncturist and Chinese medicine practitioner from Centre of Balance. Today, I'm going to talk about how to use acupressure points to ease headache, migraine or dizziness. If you are watching this video, please give a thumbs up, like and share this video for those who might benefit from our daily free-for-all DIY acupressure points. Do you know anyone who suffer from headache, migraine or dizziness? If you do, please type 1. Please don't forget to like, share or tag those who might benefit from this short live video. As usual, do you have any of these 3 tools? 1 as your fingers, 2 as your knuckle, 3 a massage device or some small rounded tool like I do. I have my usual chopsticks. Any of the 3 can be used to locate these sensitive points and apply pressure for 30 to 60 seconds, then move on to the next sensitive points. You repeat for 3 times. Since we talk about headache, I'm just going to show you a quick, what we call in Chinese medicine, the holographic image of our head. Can you see my hand here? Okay. This here, the wrist, like I mentioned before, a few days ago. This is our neck. So this area here is going to be our head. Okay, so you have the pinky side and you have the thumb side. Pinky side and the thumb side. Okay, so this is our side. The top here, our middle finger, the tip of our middle finger can be on top of the head, or basically just this whole area here as our head here, the upper one. Okay, if we're going anywhere lower, okay, you're looking at just past your knuckle down to the wrist. So what happens if you have headache? Okay, whether it's front, top or side of the headache. Okay, so we're going to use points on our fingers using these small rounded tools. Okay, please don't use anything too pointy because it's going to be too sore. I'm going to show you first, will be the headache points, and then after that I'm going to go also include points that target your neck, because in our clinic we'll always see people with headache and have neck problem as well. Image 1, like I said before, this is our head. So where I'm going to start, pinky side, thumb side. Okay, so there's 4 points on our fingers here. Let's start from the index finger. Okay, we're gonna find the most sensitive points on the second joint here. Okay, so find the sensitive points on the joint closest to the dorsal surface of your hand on the thumb side. Okay, thumb side. So you find the most sensitive points here, and you press and hold for 30 to 60 seconds. You can repeat that 3 times. And this is for frontal headache. Okay. Now we move on to the middle finger. Again, on the second joint here, closest to the dorsal surface of the hand, and this time is on the thumb side as well. Okay, so middle finger, and you find the most sensitive points. You hold for 30 to 60 seconds. Okay, this is for top of our head. And now we move on to the third point. This time is on your ring finger. As usual, you find the most sensitive points on the second joint closest to the dorsal surface of your hand. And this time it's on the pinky side because it's closest to your pinky. So pinky side, ring finger, you find the most sensitive points and you hold for 30 seconds to 60 seconds. Now you move on to your little finger, which is our pinky. Again, you find the most sensitive points on the second joint here closest to the dorsal surface of the hand. Again, it's on the pinky side. Okay, and then you apply pressure for 30 to 60 seconds. And this on the pinky side here is for the back of our head. The one before on the ring finger is for the side of our head. Number 2, in some cases, this one here might not solve your pain completely, which brings us to the image 2 zone, where you may want to move up to the first joint here to find the most sensitive points. Again, you press and hold for 30 to 60 seconds. Okay, and then on the ring finger here, on the first joint, on the ring side, pinky side. Okay. The third one, on the middle finger, you can either find it on the first joint or find the most sensitive points at the tip of your middle finger. Okay. So on the thumb side, on the thumb side and the tip of the finger. And then you move on to your index finger. Again, find the most sensitive points. That's which will lead us to our image 3 and 4. We can move further down, since like I mentioned before, neck can also involve with the headache. So what happened here? Then we move further down, which will relate to our neck, and we find the most sensitive points between the metacarpal bone. Okay, between the metacarpal bone. Okay, between the bone here. In you find the most sensitive points. Okay, palpate, and you find the most sensitive points, and you hold for 30 to 60 seconds. So 1, 2, 3, 4, and do all these and find the most sensitive points. And now we move further down to our wrist. This is where our neck is. Okay, this is where our neck is. Okay, now either with the tool or your knuckle, okay, you find the most sensitive points and you hold for 30 to 60 seconds. Once you finish, you move on to the next one. Okay, you find the most sensitive points. Keep going all the way to the thumb side. Okay. Last but not least, we can also massage around our ears, or not around our ear, at the massage around the ears, or the earlobe to be exact, to earlobe, or the anti-tragus. You can see, hopefully you can see the anti-tragus. I'll just quickly show you. So it's just around your ears, so you can see it run around here. Okay, you can see it. Okay, I hope you can see. So you can see the different names there. We focus on this area here and your earlobe. So what you can do with your finger, you basically just press around your earlobe, give it a good massage. So you don't just focus on your earlobe, you can also move up to the anti-tragus area. Okay, and you can ease further up too. This is for your neck. Right around here, you can press, just give yourself a massage. Can be quite tender, It's a bit tender for me, maybe I press too hard. Just remember, with your finger, you press around, massage, and you move further up a little bit. This can be very good for headache, okay? So earlobe, go around your anti-tragus, and you move further up, okay? If you find some sensitive points around here, massage up to a minute, okay? You can do both sides of the ear. Our aim is to move more energy or blood flow to your brain to ease your discomfort. So please make sure you do the DIY acupressure every day, or at least once a day. Even if you don't have it on the day, keep going, because like I mentioned, you want to move energy to your head, to remove the tension, to remove the tightness, to improve the blood circulation. So please don't just acupressure those points for the head, but you can also do points for your neck, because a lot of headache do involve your neck. Make sure you cover those wrists, those side of your hand, your ear, and your fingers. Okay, so fingers, if you can't find the tools, if you're in a hurry, you can also use your finger. Okay, just hold there, hold around the joint, and massage. Okay, just hold around this whole area, and you can massage up to a minute. Don't worry if these tips not giving you much relief. We are here for you and we care about you. So please call us as soon as possible or email us info@balancetcm.co.nz to book an appointment. We have 3 clinics in 3 different places. The main one in Hamilton, one in Raglan, and one in Auckland. My name is Kenny. That's all from me today. Please like and share this short life lesson with anyone you know that might be beneficial from it. Thank you for joining us. Looking forward to seeing you guys again. Stay awesome. Ka kite anō.